Hey folks, Professor Finn here, and we are back studying pathology today. We will be looking at the next chapter in our Pathology and Microbiology for Funeral Service students. But before we get there, take a moment to like, share, subscribe, check out the other playlists that we have for all the other subjects on the channel. And let's get the presentation up, and let's talk about disturbances in circulation. So first up, we have edema, which is also known as dropsy. It is a local generalized condition in which body tissues fill with fluid. There are four primary causes: increased permeability of capillary walls, increased capillary pressure due to venous obstruction or heart failure, inflammatory conditions, and fluid and electrolyte disturbances. So either you have, salt imbalances in your body, you're inflamed, there are obstructions and the fluid is building up, or your body is naturally wanting to absorb water for some reason. This typically happens in liver and renal failure, and the water is just storing up. So there are different types of edema. The first is anasarca, which is severe generalized edema throughout the entire body. There is ascites, which is the accumulation of fluid in the abdomen. And then there is hydrothorax, which is edema in the pleural cavity. We have hydropericardium, which is the accumulation of fluid in the pericardial sac that surrounds the heart. We have pitting edema, which is edema usually of the skin and extremities. Pulmonary edema, which is the accumulation of fluid in the lungs, and pulmonary edema is life-threatening. Moving onward, we have hyperemia, which is an increased flow of blood to an area of the body, and there are two forms. There is active hyperemia, which is an increased arterial blood supply to an organ for physiologic reasons, and there is passive hyperemia, which is engorgement of an organ or tissue with venous blood resulting from inadequate venous drainage. Ischemia and hypoxia. Ischemia is a deficiency of arterial blood flow to an organ or tissue, eventually resulting in hypoxia. Later on, we'll learn about something called a transient ischemic attack, which is a stroke. It is a cessation or a temporary lack of blood flow to an area, usually the brain, that causes neurologic problems. And we have hypoxia, which is a decrease in the level of oxygen within a tissue and may occur for basically any reason. Thrombosis is the formation of a blood clot. The blood clot is referred to as a thrombus. It is stationary and has potential to fragment. There are four common causes of thrombosis, which are injuries to blood vessels, reduced rate of blood flow, alterations in the composition of the blood, and certain diseases of the blood. An embolism is a sudden obstruction of a vessel by debris. This is caused by an embolus, which is a free-floating object in the bloodstream. So what are common emboli? Fragments of thrombi. So if a thrombus breaks and starts flowing down the artery, it is now an embolus. So a thrombus can become an embolus. Microorganisms, tumor cells, animal parasites, fat, gas, and foreign bodies. An air embolus is formed when a person suffers from decompression sickness. So a diver goes down, nitrogen builds up in the blood, they do not exhaust it sufficiently as they start coming back to the surface, and a bubble forms. And that bubble will block fluid, and that causes the problem. Consequences of an embolism include a blockage of blood flow to tissue, which is the ischemia, a death of tissues distal to the blockage, which is the infarction. So all the tissues downstream that would rely on that blood providing nutrients and oxygen now die. And this can spread infection and cause more systemic death. Hemorrhage is the escape of blood from the blood vascular system, the most common forms of injury to the circulatory system. First up are petechia. These are antemortem, pinpoint-sized hemorrhages of small capillaries in the skin or mucous membranes. These are usually found on the lower legs. These are not removed during injection of arterial embalming fluids because postmortem petechiae cause a permanent extravascular stain. in everyday language. A petechia is a rupture. If it is a rupture, it is not going to go away. Now, through creative use of dye and cosmetics, you can diminish the appearance of petechia, which is what we usually aim for. So what are some causes of petechia? Blunt force trauma, allergic reactions to medications, autoimmune disorders, liver disorders such as cirrhosis, infections such as typhus and endocarditis, vitamin C, K, or B12 deficiency, deficiency of platelets in the blood transfusions, blood thinners, blood infections, radiation and chemotherapy for cancer, and violent vomiting or coughing. Another one that's over here that you'll read about in the embalming book is petechia of the eyes, which is usually a result of asphyxiation. That is also another common one. Ecchymosis is the scientific name for the common bruise. It is associated with blood clotting disorders and prolonged use of non-steroidal anti-inflammatory drugs, or NSAIDs. These are often present in the hands and arms and are extravascular in deceased individuals. Purge. Any bodily fluid appearing in the mouth, nose, or ears. If it is coming from the lungs, it will typically be frothy and red. If it is coming from the stomach, it will look like coffee grounds. And if it is coming from the brain, it will appear to be clear or pinkish fluid coming out of the nose or ears or other areas of trauma. It should also bear mentioning that when we're talking about petechia and ecchymosis, there is one in the middle called purpura, and that is just a smaller bruise, not a larger one. So there is a size differentiation among bruises. Ecchymosis is the largest, purpura is smaller, and then petechiae are the smallest of the extravascular ruptures. Purge is the Purge occurs as a result of pressure on the thorax or abdomen due to microbial growth and or gas. It can also happen as a result of fluid pushing down and forcing the contents out. Embalmers need to treat the purge as well as the source of the purge. So we have to clean up what is coming out, but we also have to try to figure out and stop what is causing the issue. This can reoccur during funeralization, so an ounce of preventative is worth a pound of cure. Do not be afraid to re-aspirate and re-inject prior to dressing and cosmetizing, just to try to stop any bad things from happening, and do not be shy in packing the nose and throat to prevent anything from coming out. Epistaxis is a bloody nose, typically originates in the nasal septum. Hemoptysis is the coughing of bloody sputum. May it contain mucus, cellular debris, pus, caseous material or cheese-like material, or microorganisms. Usually not severe, but may be a result of a more serious condition. And anything like this is always considered an other potentially infectious material or an OPIM. Hematemesis is the vomiting of blood, and this is usually coming from the upper intestinal tract. Causes of hematemesis is an ulcer in the stomach or small intestine. That is the most common reason, is the ulcer. Scars from liver cirrhosis can also cause this, as well as gastritis, esophagitis, severe coughing, excessive vomiting, and excessive consumption of alcohol. Melena is a black tarry feces caused by the digestion of blood, and requires at least 2 tablespoons of blood. Typically, this is a sign of bleeding ulcers or gastritis, and causes of this are gastrointestinal bleeding. If it is bright red, this is, if you're finding bright red blood in your feces, this is typically a result of the opening that is causing the bleeding closest to the exit. So this could be hemorrhoids, inflammatory bowel disease, viral intestinal infections, necrotizing enterocolitis, colon polyps, or even colon cancer. That's why if you're bleeding out of your nether regions, you really want to go have that checked. The darker the blood, the higher it is in your intestinal system. So if it is darker blood, it is going through the digestive process and then coming out. The brighter red, the closer it is just to the exit. If it is maroon, you're looking at the intestinal tract. This could be a result of diverticulosis, intestinal infections, again, inflammatory bowel disease. We'll see that later on. IBD is just kind of a general term that is used to cover just about anything that happens there, as well as tumors. False melena is any discoloration not caused by blood, and typical causes of this are ingestion of licorice, lead, Pepto-Bismol, blueberries, even consumption of beets can cause discolorations that can be concerning. Hematuria is blood in the urine. This can develop from bleeding in the kidneys, ureters, prostate gland, bladder, urethra. The amount of blood in urine is not an indicator of severity of disease. So even a little bit can be a cause for concern and be an indicator of a massive problem. There are two types of hematuria: microscopic, which is where you need a microscope to detect the blood, but there's also gross or visible hematuria, where the blood is visible and appears pink, red, or brown and may contain clots. Pathological causes for a hematuria can be enlargement of the prostate in men, kidney stones, kidney disease, medications such as quinine, rifampin, and phenytoin, blunt force trauma, tumors, urinary tract blockages, viral infections, sexually transmitted disease, sickle cell anemia, systemic lupus, symptoms, abdominal pain, reduced urinary output, fever, frequent urination or polyuria, the inability to empty the bladder or void the bladder, and the urgency to urinate. Exsanguination is massive bleeding from anywhere in the body and usually refers to massive bleeding to the point of death. Causes of exsanguination can be aneurysm rupture, severe trauma or mutilation, stab wounds, gunshot wounds, or other penetrating injuries. And postmortem conditions associated with these type of interruptions: diminished circulation can lead to hematomas, swelling consisting of a mass of extravascular blood, which is usually clotted and or confined to an organ, tissue, or space. That means you might have to try to puncture the hematoma if you can even get to it. Otherwise, it's just going to continue to swell. And the problem is, because that is blood, it is going to rapidly decompose, which means it is going to be a problem for you. So we really want to know and be able to determine if we're having circulation issues and or internal ruptures. So the 8 postmortem conditions: diminished circulation. The easiest way to get around that is to get around it by using multi-point injection. If it's edema, if you're dealing with anasarca, then that's generalized edema throughout the entire body. You're going to want to inject a proper solution to try to pull some of that out. If it is pitting edema, that will respond better to chemical intervention. If it is solid edema, it will not respond nearly as well. If it is ascites, so it's located just in the abdomen, then you're just going to want to insert a trocar near the inguinal ligament and get as much of that fluid out to increase the ability or increase the effectiveness of distribution. If you have hemorrhage, you're going to have to go around the hole, which is going to be multi-point injection. Emaciation and dehydration, you're going to hear me talk a lot about this in a lot of the other chapters. You just need to be considerate of the chemicals you are using so that you do not exacerbate those situations. Rapid decomposition and discoloration. If it's discoloration, you take it as you can find it. If you can flush it because it's intravascular, that's great. But if you can't and it's extravascular, it just is what it is. And you're going to have to use cosmetic. If it's rapid decomposition, then you're going to have to treat the fact that it's rapid decomposition, even if they're emaciated. And you're going to have to use stronger than average solutions as well as higher index fluids. And the rule of thumb that if something is decomposing, dehydration is never going to be a problem. So you should be avoiding humectants as much as you can, injecting what you need to inject to get the decomposition under control. And do not be afraid, if decomposition is only in one part of the body, to use a solution that is appropriate to that part of the body and then use a more generalized solution in the rest of the remains so that you are not creating other issues because you just want to use one fluid. All right, folks, that concludes the lecture. Once again, take a moment to please like, share, subscribe, share this with a friend, post it on your social media, let people know that these lectures are out there. Take a moment to drop something in the comments below. Shoot me an email at askbigbadfin@gmail.com, and we will see you next lecture.